You're listening to The Purple Stethoscope. I am your host, Devin Nixon, family nurse practitioner. None of the information provided in this podcast is intended to nor sufficient to diagnose your personal medical issue, but there is a lot to learn, so let's start the show. Welcome back. Last week we started a conversation about primary care, and this week the conversation continues. We have 4 special guests who do not work in the medical field, and they had a lot to say when it came to their experiences with the healthcare system. I'll let them tell you though. Remember, the question we asked last week was, if you woke up in the middle of the night with 10 out of 10 chest pain, what would you do? I'm Devin, I'm 38, and I'm a family nurse practitioner.
There we go.
I'm Stevona, I'm 35, I'm an educator.
Darryl, 32, oil industry.
Miles, 20, student.
Matthew, I'm 38, and I'm an entrepreneur.
So we were just talking about primary care, what it is, all of that, and there was this scenario of what would you do if you had sudden 8 out of 10 chest pain in the middle of the night. So Matthew, what would you do?
So something like this has happened to me before, actually, a couple years ago. And so it ended up happening. I was asleep. It woke me up out of my sleep. And this was actually like 10 out of 10 pain. It was like, I remember I was sweating and rolling around. I couldn't get comfortable. So I ended up in the hospital. They ran a lot of tests. Basically, they ended up giving me something for pain. I think I ended up on some kind of drip and sent me home about 2 or 3 o'clock in the morning. And I still don't know what happened to this day.
Damn.
To this day.
To this day.
What about you, Miles? If you...
I never really had chronic chest pains, but if I had it at the middle of the night, I would try to take some form of medication and try to get a good night's sleep in. If it still isn't working, I would tell someone, my physician, doctor, whoever I could, to see if I could get this checked out, get a scan, see if there is anything going on with me, or I need to be on some kind of medicine, and just go from there.
Okay. What about you, Darryl? What would you do? Sudden chest pain, 8 out of 10, middle of the night.
I'll probably try to rough it out. Try to go back to sleep. I mean, I don't have a provider. I don't have, health care, so hopefully it stops. I mean, I don't really have medication, no pills that I can take. So, yeah, it'll probably be all bad for me if it was something serious.
Wow. Stevona?
So something like this actually happened to me. A long time ago, I was 23. I couldn't go to sleep. And I went to the emergency room. Came out that what I found out was that I had Graves' disease. So I had hyperthyroid. My heart rate was like 220. And I had to stay in the hospital for a couple of days, and I had to take medication for that until they removed them eventually.
Did you have insurance at that time?
Yes.
Do you think if you didn't have insurance, you would have gone to the emergency room?
Yes, still.
That's what's up. Yeah, because, that's major. Were you passing out?
No, I just
220.
I couldn't.
Yeah.
I just couldn't. Yeah. I couldn't function.
Wow, Darryl, you said something that, hit me. How did you put it? It would be all bad for me.
Oh, yeah. I mean, if it gets something serious like that, I mean, if I thought about going to an ER, I don't have anybody to go to, right? I don't have a health care provider or anything, so it's like, what do I do at that moment?
Yeah.
And I think about that a lot when I don't have health care. It's when, when I'm working and it's expensive, the reality is if something were to happen, something serious, I know it'll be a real expensive bill. But, yeah, when I do have it, if I had health insurance, it'll be easier. Somebody I can call, somewhere I can go to. I know that I'm taken care of. I know that I'll be good, but it's not a reality for me at this moment.
So the thing that would keep you from presenting for care at all, even if you were really worried, is not having insurance or not having a primary care provider.
Unless I really felt it was like life or death.
Yeah.
Yeah.
Wow. Miles, you had said you would take something, try to sleep through it. Do you actually have a primary care provider, like a physician or a nurse practitioner or a physician assistant, naturopath, somebody who gives you like your immunizations, or that you would go to if you had a non-urgent problem that you would just schedule an appointment with? Do you have something like that?
I believe I do, and like I said, if it does get serious, try to take something on my own, willpower it through. If it isn't really working, I guess it'll be the time to go see a physician, see what's going on, see what I can do to make it better.
Yeah. Yeah. So if that same scenario happened to you now, would you do anything differently? Because, well, let's just, real quick, Matthew, do you have a primary care provider?
I do.
And you know who they are and how to
know who they
access
are.
them and get into them?
Yeah, but he's rarely available.
I see. So you have insurance,
I do have insurance.
and you know who to call, but you can't get in.
Can't get in all the time, or at least not with my primary care physician, so I end up getting whoever's free at
Yeah.
the time.
How does that work? Like, do they know you? Do you feel like, where do you even start with somebody you don't know? Like, how does that work for you?
It's hard to say because most of these appointments are about 15 minutes.
Yeah.
So you actually see a physician for about 15 minutes.
Mm-hmm.
And I kind of walk out feeling the same way I did before I came in. And I leave with the same frustration that I had when I made the call in the first place. So it ends up feeling like a waste of time.
So you guys can't see, but there's like a lot of nodding of heads going on in here. So I want to like get more feedback. Stevona, you're nodding your head. Darryl, you're nodding your head.
It's just from the fact that when he said that when he did have 10 out of 10 chest pains and he went to the ER, he felt the same way going in and like no answer when he got out. So it's like if that were to happen again, why would I go to the ER?
Mm-hmm.
You know, it's.
So where would you go?
What else is there to do? If you feel like you go to an ER and you don't get help, or you feel like, why am I going here? Like, I'm wasting my time. It's like, rough it out.
Yeah.
You know, you just stay, but still, it's like, you know, you never know if that one time is something like chronic and something that you need to go. But if you don't have any answers, like, what do you do? Like, what decision do you make when you know you're not going to get answers?
And Stevona, you're nodding as well. Especially when he was saying like it's usually 15 minutes.
Mm-hmm.
I leave the same way. Like, talk about it.
Well, it's a requirement now that your physician stays with you only for 15 minutes, which I feel like in 15 minutes there's nothing you can do. Like you're not able to solve the things that you need to solve at that point. So I have that happen a lot. So when I'm at the doctor or whatever, and I'm really like getting into what I need to say to my physician or whatever, it's like a knock at the door, boom, boom. You got somebody else, and I'm like, oh, okay. They interrupt our whole little conversation, you know. So I had to like speed it up and get up out of there. So yeah.
Are they talking to you with one foot out the door?
Yeah, so hard. This is great feedback. I hope those of you who are listening and have friends in the healthcare industry that maybe you'll share this episode with them. Because me, like on the inside, working on the inside, it's crazy to hear what you guys are saying because I'm always torn between like how much do I tell the patient? Like, do they really want to know all the details of everything? A lot of times, a lot of the testing does come back as ruling out. And what I mean by that is like, say with chest pain, there's a test called a troponin, and it's a simple blood test, so we'll draw it. It's either elevated or it's not elevated. If it's negative, then it's more of a rule out kind of thing, so there's really nothing to tell you other than, your first troponin was negative. I don't think this is cardiac, but we're going to, continue looking for answers. And I don't know if that's reassuring or not, or like when it comes to how much you do want to know, because what I'm hearing you guys say is like it's no difference whether you go in or not, except you get a bill.
Mm-hmm.
Yeah,
that's rough.
That's what it's like though. Like, right, I just went in for my foot, right, that I rolled 2 weeks ago,
How did you roll it? Do you want to tell the people how you rolled it?
Were you dunking on somebody?
You know what I'm saying? Yeah, pretty much. You know
No,
what I'm saying?
You
You know what I'm
wasn't
saying? So
hooping?
I was giving my son the business.
Our
On that court,
son.
you know what I'm saying?
Our
I was
son.
giving him the business.
Mm-hmm.
You know, giving
He
him
won
that work.
like, how many games did you win? He
More
won
than he
like,
did.
they played 5 games. He won 4 games.
Marcus won the last game after I rolled my ankle.
Oh, of course.
So he's the man on the court, and he was been limping at home ever since. And you know, Marcus is like bebopping
Look,
around.
you getting off track. Look, hey, look. I
So
rolled
you
my
rolled your
ankle.
foot.
This is the point.
Yeah.
The point is, I rolled my ankle, right, but my foot snapped in half. Long ways. You know, that's how I went like wow until my foot collapsed.
Oh, yeah.
So I toughed it out for about a week, a week and a half, and I'm like, all right, let me go see, make sure ain't nothing wrong with my foot. So I go to the doctor. She seen me for like 10 minutes.
Yep.
Sent me to get an X-ray. I got a call saying, hey, the X-ray was negative, so you don't have a break. But here I am sitting here 2 whole weeks later. I still don't know what's wrong with my foot.
Yeah.
Feel still in pain. I got a job where I work. I walked.
swollen?
Yesterday I walked 7.5 miles before I even got home.
Yeah.
So
So one thing that
Yeah,
I keep
that's
hearing
forward.
you guys say that's
Not
wild to
forward.
me, because I wanted to be a nurse practitioner since I was 14, and to me, I guess always knew what a nurse practitioner was, but I keep hearing y'all say physician, my physician, and like you went, and I know for a fact that the person you saw wasn't a physician, it was a physician assistant, and does it matter to you? I mean, or I don't know, I have people call me doctor all the time, and I'm always saying, well, I'm a nurse practitioner, I'm not a doctor, and I make that because my schooling was years less than theirs, even though we might function in the same role. Does it matter to you guys whether you see a physician or nurse practitioner?
To me, no, mainly because I mean, I really don't know the definition of each.
Right.
You know, I know at the end of the day, if I go to if I go to youth nurse practitioner, or if I go to a doctor or a physician, I still expect the end result, the same, you know, like, to get help. Like, if you're seeing me, I feel at that moment comfortable enough that you know what you're doing.
Gotcha.
You know, so if it is a nurse practitioner or a doctor, it's not like I'm getting heart surgery. I'm like, hold on, do you know what you're doing? You know, but I just feel like if whoever it is, I know that I feel like, okay, I'm leaving my ankle injury or my chest pain in your hands, because I'm sure if you just, you know,
If you're
if
seeing
I'm
me,
if I'm coming in,
present
you
your-
know,
yeah.
you
Gotcha.
qualify. So
Okay.
as far, I know for you, that's what you went to school for.
Right.
You know, you went to school for it, so you want to make sure somebody, like, no, I am a nurse practitioner, so that's what you're going to call me. But
No,
for me,
and I don't say it to
Okay.
I say it because I don't want people thinking I'm impersonating a physician.
oh, okay, no,
You know
yeah.
what I'm saying? I am a nurse practitioner. I'm proud to be a nurse. I was
Yeah.
a nurse prior to becoming a nurse practitioner, yada, yada, yada. But I was just asking you guys
Oh,
for
no,
my understanding,
yeah.
like, is there a difference when you say the language, or are you just saying the person who came in with the white coat that take
Nope.
care of my problem?
I mean, I look at it the same way as like, you know, if you go to a restaurant, we just came from, you know, whatever. I'm like, excuse me, Darryl, you know, could you bring me another round of drinks? Something like that, you know. I'm like, oh man, Darryl's such a good waiter. And he was like, excuse me, no sir, I'm not a waiter, I'm actually a food server. Like, you know what I'm saying? Like, you know what I mean? Like,
okay.
it's title's right, but you
Yeah.
presenting to me as the guy who's taking care of my table. So like, either way,
Gotcha.
right? So whether you're a nurse practitioner, a PA, or a doctor, to me, you're the person presenting me with care at
I
that
see.
particular moment.
Okay.
So I'm not gonna say, well, it's a nurse practitioner.
Gotcha.
I don't want to see.
Well, and
that
I don't
Yeah.
want to get too far
Yeah.
off track of that.
Right,
I was
right.
just curious if you all even, if you're saying physician because that's what you prefer, or if you
I
just
think it's
saying
probably
it
because we know that more. It's just the language.
I
You know,
gotcha.
it's
you know it.
It's
Okay.
the role.
yeah.
It's the role. Yeah.
Gotcha. Okay.
Yeah.
I ain't
So-
know the difference.
Miles
Right,
doesn't
yeah.
know the
I
difference.
ain't know the difference.
That's okay. But what's really important is that you feel like you're getting taken care of. And like what
Yeah.
I'm hearing from you guys, and I know my experience, so just a little background. I went into this because of the experiences that I had. Because I saw what happened when my mother presented for care. I saw what happened when my father presented for care. People in my family were dying young. And, you know, the stuff that you heard, you know how you could be a kid and you hear the grown-up say something, you're like, that don't make no sense. Like,
Right here.
they would say, oh, Big Mama died because they gave her the wrong pill. Who is they? What are you talking about?
Yeah.
Like, you know what I mean? But then more and more people are dying and dying and dying. And they were dying a lot younger than my non-black friends, grandparents and aunties and uncles. Like, they don't have people in their families dying in their 40s and 50s and 60s. So I'm feeling like there's a black cloud over my head. I only have so much time, you know? And so that's why I went into this, because I saw like there's a big disconnect between like our experience and what we're hoping to provide as an experience on the provider end of it. So no, that's really, really good feedback. But again, 8 out of 10 chest pain, middle of the night, you're probably not going back to the ER because you didn't walk away with anything but a big bill. You don't know who to call, so you taking some Pepto-Bismol, going back to sleep. It depends on whether you got insurance or not, 100%.
Sure.
And in your case, you did go and present for care and found out you had a very bad problem, like that needed immediate attention. So that's a wild. If I could say anything that I would want like the culture to know, as far as that goes, is that your primary care provider is your point of contact. They're your dispatcher. If something happens, that's the office that you call. You're a patient of so-and-so's. This is what's going on. Can I leave them a message? Can I schedule an appointment? Boom, boom, boom. Like, that's what primary care is for. And there's a lot of statistics out right now. I just read an article, actually, about maternal death rates. And how, the United States in general does not look very good when it comes to maternal deaths. And by maternal, I mean pregnant women, women who just had a baby, right? But for Black women, the death rate is 3 times what it is for white women. 3 times. And so you look at that, and of course it's multifactorial, right? Like, are they listening to us? Do you guys know about Serena Williams and her issues?
Of course.
Yeah. Like, she's Serena Williams, so it's not a money issue.
Yeah.
And she had a problem before. She had pulmonary embolism, like, blood clots in her lungs. She's had this before. She's having the symptoms of it again. She's telling them, I need a CT scan. They're not acting. They're not listening to her. You know what I'm saying? Like, crazy, right? But, so there's that fact. There's like, are you listening to me? Are you hearing what I'm saying? And do you care enough to do something about it? But then there's also 60% of the things that the maternal deaths are caused by are chronic issues that aren't handled in primary care. What do I mean by that? So just a quick lesson, because I like to teach. An acute issue is something that's 6 months or less. You've only been dealing with it for a couple of months, max. It becomes chronic after 6 months. Okay? So you get in a car wreck, you hurt your back hurts for 2 months, it's an acute injury. Okay? 2 years from now, you have chronic back pain. So a chronic issue is something like hypertension that's never been taken care of. Do you guys know what your blood pressure is? Do you know where your blood pressure runs?
Yeah. I'm about low 100s, like 104 over 80. That's where I typically run. Yeah, that's me.
Miles, do you know?
Nah, but it's probably like low because like...
You would think, because you're so chill, right?
Well, that I was going off of I'm young.
Okay, Darryl.
I mean, I think it was doing better last time that you took my blood pressure, but I'm not really sure what the number was. But yeah, I know the heart rate was pretty down, but the blood pressure, I think it was fluctuating. But yeah, it was nice to know that I wasn't diabetic. That's for sure. I think, I was like, that's something I was worried about. I love my sugar for sure.
Yes.
I love
your
my
A1C
candy.
was good. I'm not gonna out you on your blood pressure, but
I can't remember, but I mean, I'm just saying.
We'll follow up.
For sure.
Follow up.
I've been on it though. I've been on it.
Stevona, do you know what your blood
Yes,
pressure runs?
124 over 84.
Man, y'all are all beating me. I'm over here. I take 2 different medications for blood pressure. And that, on 2 different medications, I'm in the 110s over 60s, 70s. But without medicine, I'm 140s, 90s. Actually 150s, 160s, 100s at the worst. So that's when I got on medication. But, you have to know that stuff to even do anything about it. And you don't know it, Miles, if you don't even know who your provider is. Or you don't have one, and you don't have the access to that kind of information,
I don't, I guess.
Yeah, no, but that's okay. That's okay,
I'll do that later tonight.
There
I'll
you
do my
go. See,
homework.
that is what I'm trying to achieve with this podcast. For you and somebody else like you to be like, you know what? I don't know my blood pressure. Let me go find out about this.
Yeah.
Yeah, I gotta find
That's
out
what's
my
up.
blood pressure.
Darryl,
my medication.
I know you know your A1C. Anybody else know their diabetes numbers or A1C?
Well, I ain't got no wait, I don't know.
You don't know what you
You
got.
don't know.
Matthew, do you know?
Like A1 credit? No, I'm playing. No, I know my numbers is good though. I know every time I have labs in, my labs are good. I don't know all the numbers though.
Yeah. Yeah, those are
I'm
those
gonna
are
go with that
numbers
one.
to know.
I'm gonna go with that answer.
I would say, like, if you want to know anything in your establishing care visit, you want to know your blood pressure, you want to know your A1C, and you want to know your cholesterol. Cholesterol.
My cholesterol's outstanding.
What's cholesterol?
That's just what I know from what the doctor told me.
He's in perfect health, girl.
Allegedly.
Well, I think my cholesterol is good. I think the blood pressure is my only thing to make sure that that's down. But I haven't had my blood pressure taken in a while. We'll do that. I already had a glass or two, so catch me in a week.
Circle
I
back.
just gotta lose this
Miles,
weight.
go ahead, and then we'll wrap up.
What's cholesterol?
Ooh, that's such a great
No,
question.
it's the stuff you put in your hair and you let it sit for conditioning.
You know what?
I thought
Conditioner.
you put it in your oil.
Right.
It's car oil.
It's car oil.
Cholesterol oil.
Quit messing with
It's,
him.
Why you gotta?
Those are different types of cholesterol.
Okay,
50
listen,
over 10?
let's wrap up, Miles. I promise I'll get back to your question. I just don't want to veer too much off subject. If you guys could tell the healthcare professionals one thing, one sentence, what would you tell them? If you could give them some feedback, some advice, tell us.
I want to go last.
So you're the first one to speak, but you want to go last.
Yeah, I want to go last.
I'll go.
Go ahead.
Listen. Just listen. That's all you gotta do. Listen. Listen to the patient, whatever they got going on, what's wrong. Okay, say for him, his foot was hurting and he was in the ER. They didn't do nothing. Listen to what he needs, not what you think.
That's deep, Darryl.
I don't know if I would tell them anything, like, if I had one sentence. It's just for me, just to have somebody I'm comfortable with. Somebody that I feel like if anything's going on, I can call them and be like, hey. Because, I mean, like, I look at when people, their kids or whatever, they have something so minor. But they're, hey, we're in the ER or we're at the doctor's or we're doing, like, that's something I wish I can do. Like, every day, like, if my tooth is aching or something so small that you probably just say, whatever, I'll just chill and rest. I just want to be able, I can call and be like, hey, this is going on. Can I stop by for a couple of minutes and see what's going on?
Oh, okay. You like that informal relationship.
Yeah, if that'd be cool. If something like I don't. So I wouldn't really say a specific sentence for a physician or a doctor or whatever, but it would just for me somebody I'm comfortable with that I can come to for anything health related. That would be my ideal doctor-patient relationship.
What's up, Stevona? What would you tell him?
Just to spend more time with your patient and provide that space for them to explain what is going on with them, and just be patient.
Yeah, I would say I'm scared. If I could communicate one thing, it would be that I'm scared. I wouldn't be here if I wasn't worried.
Mm-hmm.
And so, yeah. Somebody tells me they're scared, I'm going to do my best to reassure them and explain things, and I need that same thing. So if I'm here, it's because I'm scared.
Yeah, because it is primarily in your hands, I feel like. Well, initially,
Yeah.
we don't really want to say everything because we just don't know. Like, when you go with your parents and they're talking about, like, have you had sex or whatever, like, we're scared to be like,
I put parents out the room. I put parents out the room and I ask kids those questions and they're on the edge of their seats and they tell me everything.
Yeah.
And I tell them, hey, that's what I'm here for,
Like if that,
I should be more like that with my doctor. I keep to myself.
No, I mean, but it's hard when it's like that. But I can see that being normal.
It just
but
seems awkward just having that conversation for me. Honestly,
oh yeah,
it's just awkward. Just like, hey, are you active? It's just like, I don't feel comfortable answering that. Just.
So do you understand why they're asking?
Yeah, I'm understanding why you're asking, but it's just like the way they just approach it. Just like, are you sexually active? Like, what's going on? Like, they want to know everything. It's just like, it seems kind of intimidating.
It is.
Yeah, for sure.
That's crazy
good.
for you to say that because I'm like that person that just goes there and I'm like, when I have people for sexually transmitted diseases, one of the things like for gonorrhea and chlamydia, I always want to do a throat swab and an anal swab if you're, I know.
know.
So, but basically, what I'm gonna
Oh.
don't corrupt him.
Exactly
Oh my
what
God.
it is.
So what I would literally say, Miles, and I don't even think twice about this. I'm like, are you sexually active? Do you use condoms? Are your partners male, female, or both? And to me, it just, you don't have to answer sweet.
My thing is, it's just like...
You gonna get your booty swabbed today?
My thing is just the way they ask
Right.
the question, it's just how they approach it.
It's-
They just be on their seats like, okay, have you done this? I would feel more comfortable if you got kind of just lead into it.
Yeah.
You know what I mean?
It doesn't seem like you're talking to somebody on the same level.
Right.
It's more like I don't know, like not just a parent, but yeah, when they ask like, do you drink? It's like, damn, yeah, drink. But they
Why
make
so
me feel.
defensive? Because
I think it's in the same way.
Because
So again,
It's the presentation,
I
100%.
practice cardiology for the most part, and when I'm asking about alcohol, it's typically because
No, we get it.
alcoholic cardiomyopathy, or you might have atrial fibrillation. I'm trying to figure out what your trigger was.
No, for sure.
I don't care if you drink or not. I care if you're an AFib and your heart's beating so fast that you end up in heart failure, and I'm trying to help you figure out what the trigger is. So it's like, this is so good for me. Like, I don't know. I'm trying to do this to, like, help bridge gaps.
No, for
but
sure.
I think this is super good for me as well because I'm like, why defensive?
No,
Like,
I get it.
Like,
It's-
we're on
yeah.
your team. I'm on
It's-
your
it's-
side.
I
You're
think- I
like,
think
the
it's
way you guys
I think it's how
Yeah.
it's approached for
so
sure.
would you like us to be like, so what you drinking on? You'll be
No,
drinking.
It's just
also,
like, you know,
is
kinda
it
lead into
relative
it.
though? Like, is it relative to why I'm coming in? Like, so sometimes like I hear like, well, do you drink? Do you smoke? And I'm like, oh, are you hearing what I'm saying? Like, you know what I'm saying? I sprained my ankle. Like,
Yeah.
why are you asking me if I'm
Yeah.
drinking or smoking? Like, it's just like
I see.
I
I
can't
get
even
that.
relate your questions to why I'm here.
Oh,
You know
this is
For
so
sure.
good.
For
I'm
sure.
gonna have so much fun with this.
Because I've been asked like when
when I ask
whenever
about
I'm working,
smoking,
I don't. Yeah, I mean
It's you have arteries in your legs, and smokers'
sure.
arteries will clog. They get something called peripheral arterial disease.
What's that?
It's when the
that in
arteries in your
English?
legs clog up. And they clog up when you're walking, and
Still
people get
awesome.
pain. They get. I know. I gotta work on that. You guys are gonna help me
I'm
work
gonna
on
have
that.
to really study that.
Peripheral is like the outside, the extremities, right? Your arms and your legs, and then arterial is like your arteries. You have veins
What's
and
arterial?
arteries.
your arteries.
Your arteries pertaining to your arteries and disease, like they're clogged up. And so if you're coming in, I do this. Oh my gosh, I do this every day. People are like, well, I'm having pain in my legs. And like the next thing in my head is like, are you a smoker? But that's me connecting
but
clinically.
that
and you're like,
that's better.
what
Like
you
if
doing? I'm
I
talking
go
to you
in,
about my leg pain.
No, exactly. No, that's
Yeah.
smart. That's better. Like if he goes in and he has a sprained ankle, like how many times do you drink? I know if I drink heavily, I know that's not. I was playing basketball. And I sprained my ankle. It wasn't because I was drinking. So help me
So I'll
figure this
close.
out.
I'll
Right.
close with this thought.
I didn't get to talk and tell my message. I got a message.
Oh my gosh,
Talk to
please,
us.
I'm
Matthew.
gonna tell
Talk to us, man.
Look,
What are you gonna tell them?
my message is not to the providers. My message is to the hospitals and to the clinics and the whole medical system out there. And you can't see me right now and listen to me, but I'm pointing my finger right in your face right now. Right? Stop putting business over people. You know what I'm saying? That's the problem with the medical system, just like that's the problem with the educational system. It's not the teachers, it's the system. It's not the doctors, it's the system. Stop putting these doctors in these situations where they gotta see 30 patients a day and they ain't got
And
more
these
than 10
nurse
minutes.
practitioners.
And these nurse practitioners.
And these physician
included.
assistants
And
and
everybody
naturopaths.
that's seeing patients, you know what I'm saying? Stop putting them in these situations where they can only see somebody for 10 minutes and they can't fix my foot. You know what I'm saying? It's your fault. My finger in your face again.
Yeah.
You know what I'm saying? See me.
I'm gonna leave you
Gangsta.
guys with this thought.
Gangsta.
Talk to him.
Wow, did I lose my thought watching Matthew over there like get so animated?
He had a point.
But no,
though.
what I
100%.
got it back. So the thought that I want to leave you guys with is from the primary care position. We are trying to maximize the moment. I might know that I'm not going to see you for your regular screening. I'm not going to see you for your annual physical. I'm not going to see you for your mammogram, for your colonoscopy, for your STI screening and testing. I'm going to see you when your foot hurts. So I'm going to try to cover as much ground in that appointment as I possibly can because I don't know when I'm going to see you again. I want to know if you smoke and if I can help you with smoking cessation because I know what smoking leads to down the road.
Yep.
I want to know if you're drinking too much or if you have symptoms that are related from drinking, or if you might be a functional alcoholic and don't even know it, like I want to offer as much as I can in this one capture. So yes, you're going to get questions that have nothing to do with the reason why you came in. And my beg of y'all, because the other thing that you can't see, y'all that are listening through the podcast, is everybody in this room is Black. And this is like my passion, right? Is primary care for the culture, healthcare for the culture, right? Please don't think that your providers, your healthcare providers, are being nosy, that we're digging into areas that you didn't invite us into and all this and that. What we're really trying to do, and maybe I should just speak for myself, because maybe some people are out there being nosy and condescending, but that's not where my heart's at, so I'll speak for me. I'm trying to do as much. I'm trying to invest as much into your health as possible in this one appointment that I get, because I'm not going to get you back until there's another accident or another issue, and then I'm only going to get another 15, 20 minutes. So that's what I would want to leave listeners with, is that we're on your team. We're on your side. We want you to live long and prosper. And with that, I just want to thank all the guests, Matthew, Miles, Darryl, Stevona, me. I'm your host, D, the NP, on social media, at D like Devin, the NP like nurse practitioner. That's on Instagram. That's on Twitter. That's on Facebook. And what else? This is the Purple Stethoscope that you're listening to. We got a lot of good content going this week, so I have some ideas of what we can talk about in the future, but y'all are going to have to wait for that. Thanks for tuning in.
Thanks to the sponsor, what I'm saying, to Cal.
What? I never know what he's talking about.
That's just guy talk.
What's Takal?
It's just guy talk.
It's guy talk.
Because I don't even know.
So,
To cow, Devin.
do you guys want to say bye? How are we going to wrap these episodes up?
I think you did a good job, right?
IG, miles away,
Okay.
no S's.
You did a great job
Z's.
already.
I love y'all. Y'all are the best. Thanks so much for tuning in to the Purple Stethoscope. I'm your host, Devin Nixon, family nurse practitioner. You can find me on Instagram, Twitter, and Facebook at D the NP. That's at symbol D like Devin, the NP like nurse practitioner. If you like what you've heard today, go ahead and share the episode, or even better yet, rate and review. I'll see you next time. Thanks for listening.